Hi, I'm Dr. Reza Jarahi, Clinical Associate Professor of Plastic Surgery and Pediatrics at the David Geffen School of Medicine at UCLA, and I'd like to spend a few minutes talking to you today about the care of children born with cleft lip and palate. I'm going to talk in general terms about the needs of these children at various stages of their lives, and in other videos I will go into more detail about specific surgeries. For now, I just want to give a brief summary about some of the things that you might expect as a parent or as a patient in terms of different kinds of surgeries that we offer patients with cleft lip and palate during their early childhood, later childhood, adolescence, and early adulthood. So the most important thing to consider about your son or daughter, if they're born with a cleft lip and palate, is that they are a beautiful bundle of joy, just like any other kid in the world. And your job as a parent, I think, is to just give them all the love that you possibly can, as you would with any child. It just happens to be that they have a little difference and might require some medical and surgical attention growing up. So between the time of birth and the time of the first surgery, the most important thing that we can offer is love and support and a nurturing environment for your child. Now, in addition to that, there are a couple of technical things that we want to focus on in the case, say, of a child with a cleft lip. The first is feeding. Feeding can be tricky in kids with cleft lip and palate, primarily because they cannot make the same suction force that a child who doesn't have a cleft palate can. And so using a typical bottle that you might use may be difficult for the baby. And the baby may have a very difficult time nursing. It takes a lot of energy to nurse or to use a typical bottle with a cleft palate because the babies can't generate the normal amount of suction force. So making sure the baby's getting the right amount of calories so that they can remain healthy and grow is very important. And we have nutritional therapists, occupational therapists, and even your pediatrician could recommend the right kind of cleft palate feeder, and so your baby doesn't have a hard time getting all the calories and nutrients that they need. Another thing we like to consider is whether or not your child is a candidate for something that we call nasoalveolar molding, or NAM. What that refers to is a process whereby we can actually take the parts of the lip and the palate that are separated and bring them closer together from the time of birth to the time of the cleft lip repair in order to bring the lip segments closer together, the palate segments closer together, and potentially help us achieve a better result in the operating room when we repair the lip. The other thing that the molding procedure does is helps give the nose a better shape so that when we do the lip repair, we can potentially get a better result on the appearance of the nose during that surgery. Typically, I like to repair the lip at 3 months of age. At this age, your child has usually gained enough weight to have a safe anesthesia, and the soft tissues of the lip are sturdy enough and robust enough to be able to hold the sutures that we use to repair the lip. It's usually an overnight stay in the hospital, and the recovery is quite quick. Babies recover quite quickly from these surgeries. At the time of the lip repair, not only do we repair the lip, but I also like to repair the nose to try and get the most symmetry of the nose as I possibly can. At the time of the lip repair, I also like to repair the nose to try and get the nose as even as possible on either side of the cleft. At the time of the lip repair, I also like to do a repair of the nose to get as much balance in the nose as possible and give it as much symmetry as possible so that the whole lip and nose as a unit look well balanced and have the best appearance possible after the first surgery. I usually like to repair the palate between 10 and 12 months of age. This is when babies start to speak, and the most important reason to repair the palate is to give the babies normal speech. At the time of the palate repair, almost all babies will require placement of tubes in the ears to allow drainage of any fluid that's accumulated inside the ears. The ear issues go along with the cleft palate and usually resolve once the palate is repaired over time.